Headaches are very common during pregnancy. Probably one of the top concerns or complaints that patients have during pregnancy. And there's a lot of reasons for that. There's some hormonal changes, there's changes to sleep patterns, there's changes to posture. A lot of patients change their diet, they change their exercise pattern during pregnancy as well. But probably one of the bigger things is between 12 and 14 weeks, entering the second trimester, there's some changes in blood volume and fluid shifts. So headaches are very, very common. Late in pregnancy, we need to be concerned about pregnancy-induced hypertension, preeclampsia, etc. So late in pregnancy, certainly in the third trimester, we're going to think about checking a blood pressure. But in the first half of pregnancy, certainly less than 20 weeks, headaches are going to be very common. Things that can help in general are trying to optimize sleep, making sure that you're getting some fresh air and some exercise. Magnesium in the form of a tablet, which you can get off of the Fullscript link off of our website, or an Epsom salt bath can be helpful, warm instead of super hot. And vitamin B6, 25 milligrams 3 times a day. Again, you can get this off of Fullscript. It's going to be similar to what you would use for nausea prevention. I've had some success with those kind of things. Extra strength Tylenol is appropriate, certainly for severe headaches, and Excedrin Tension Headache, which is extra strength Tylenol plus caffeine as well, can be an option for severe headaches or migraines. There are also some preventative medications that can be prescribed for probably more daily headaches. So feel free to reach out if you have any questions, but just know that headaches are very, very common. They often do get better later in pregnancy. Have a great day.